National Center for Healthy Housing and the American Lung Association. My name is Tiffany Belser, and I'm a Director of Nationwide Health Promotions with the American Lung Association. Before we begin, we wanted to mention a couple of navigation reminders. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in the background that could cause issues. If you have difficulty hearing the presentation, first check the volume setting on your computer or your device. If you still have trouble or cannot see the slides, refresh the webpage or log out and log back in using the same link that you received to access the webinar. All attendee lines have been muted and the camera feature is disabled. Please submit any questions for the presenters in the Q&A box. We will try to address as many as we can before the end of the program. To submit a question, click on the Q&A icon on your screen and then type your question into the box. If you're tuning in from another device and don't see the Q&A icon, try clicking on the three dots and then scroll to where it says Q&A. Additionally, if you have any technical difficulties during the webinar, you can submit those to the Q&A box and we'll try to help as best we can. This webinar is being recorded. The webinar link will be sent to all registered attendees. The webinar recording will also be available on the American Lung Association website, along with other radon resources, which you can find at lung.org/radon. Next slide. For today's presentation, we will hear from the featured presenters that you can see on this screen. We will be sharing presenter bios and a follow-up email along with the webinar recording to all registered attendees. I'm now going to turn it over to Jonathan Wilson, Deputy Director with the National Center for Healthy Housing.
Thank you, Tiffany. I'm really excited to be here today and share some information with you. To give you a sort of a feel for the lay of the land for the next hour, I'll be talking first about the National Radon Action Plan. Then I'll turn it over to Amanda, who will talk about some funding opportunities for radon mitigation and testing. And then I'll come back on, talk about a new brief that the National Center for Healthy Housing has out, a 10-pager talking about the CDBG program in addressing indoor air, including radon. And then what I'm really excited about is we have three featured presenters today from the communities, from the states and localities, talking about how they are using CDBG funds for radon testing and mitigation. So with that, let me just jump into the National Radon Action Plan. So first, why focus on radon? Well, radon is the leading environmental cause of lung cancer deaths in the United States. Exposure to indoor radon leads to more lung cancer deaths every year than any other environmental source in the United States. An estimated 21,000 lives are lost to lung cancer from radon each year. Radon also increases the likelihood of getting lung cancer for those who smoke or are exposed to tobacco smoke. We have proven technical solutions to find high radon indoors with simple tests. And when we find it, we know how to take action to reduce the radon levels. We also know that this work should be done by trained professionals and that there is a cost. The National Radon Action Plan, referred to as NRAP, whether we're talking about the group or the plan, is a collective action initiative of industry, housing and health champions, and government agencies, and others to navigate together the complex challenge posed by this invisible indoor radon exposure that causes lung cancer. What we want to share with you today is that we have the technical knowledge on how to find it, on how to fix it, and we want to share some tools on how to fund it. The National Radon Action Plan, or NRAP, 2021 to 2025, builds on NRAP 2015 to 2020 and the Federal Radon Action Plan from 2010 to 2015. In our current cycle, which is our third 5-year sprint to a series aimed to eliminate avoidable lung cancer deaths in the United States from indoor radon. This cycle seeks to build on previous successes by focusing on expanding radon protections for all communities and buildings. These protections are intended to protect occupants in homes, schools, and other buildings such as daycare centers. This group of NREP coordinators is called the Leadership Committee. The National Center for Healthy Housing, or NCHH, and the American Lung Association, ALA, have been part of this effort since its inception. NCHH and ALA partner in the NREP with many organizations of all levels: federal, state, regional, local. Together, we pursue changes to housing rules and financing requirements, environmental and health funding availability, and population health strategies to address the problems of radon in our homes and other buildings. Okay. Let me take a moment for attendees who might not be as familiar with the basics of radon. Radon is an odorless, colorless, radioactive gas that comes from the ground and can enter into our buildings. Radon can also get into well water. It is associated with certain geological conditions, which makes radon more prevalent in some communities, but all communities are at risk. Once radon enters the home or building, it can linger there and expose inhabitants to radiation. Exposure is on a continuum. The higher the radon levels and the longer the period of exposure, the greater the risk. There is no safe level, but EPA and other agencies recommend mitigation when radon levels in the lower living areas of a space exceed 4 picocuries per liter. Simple, low-cost tests can measure radon levels. A radon mitigation system can be installed in new or existing properties. This mitigation system draws the radon away from the home or building before it enters the space. In an existing home, these systems can cost around $1,000, $1,200, although there is a range depending on the community and the access to mitigators. NREP's Leadership Committee, of which I am a member, collaborates to identify and promote policies and actions to address radon. Examples include housing finance rules to include radon testing and mitigation, energy workforce development efforts to train certified radon staff, government program rules to require or incentivize testing and certified fixes for elevated radon in homes and schools. We know that these steps will prevent lung cancer by reducing radiation indoors, making air safer for everyone. But strategies are complicated and take time. We know the kinds of big levers of change that can lead to saving many, many lives from an avoidable but invisible carcinogen like radon is a bit like steering a battleship, moving slowly and requiring many different buttons, gears, and levers to coordinate those giant changes. But once those ships do start to move, they create some significant impact. In this way, we focus shared energy where it can yield the greatest impact now, while helping to sustain systems that will eventually build radon out of our homes, our schools, and other buildings. Today, we'll share about one of those long-term complex strategies for change that the NREP leadership prioritized because we know that it is a significant obstacle and a required change in order to save lives at a population scale. By taking action, we can find and fix indoor radon hazards across the country so we can see a reduction in lung cancer and avoided deaths in our national data. The need to find and direct funds to support environmental risk reduction in homes, which is what this NREP strategy is all about, is not limited to radon. In fact, the most effective built environment health work bundles identifying and fixing all known environmental risks in homes and schools where we have technical solutions like mitigation, not just treating risks one by one. But this requires ample funding necessary to build and point available funding towards both needs. Some of our discussion today will be about new sources of funding to address radon, but we'll also talk about using existing sources to address this problem. The Leadership Committee knows very well that our nation needs more available funding to flow to where people can fix and mitigate radon, especially for low-income homeowners and renters. All indoor hazards matter, whether it's lead, water leaks and mold, asthma triggers, electrical hazards, trip and fall hazards, or basic lack of heat or hot water. We want you to know that there is existing resources to address radon hazards now, but also know that we need to work together to expand that funding. While we've made great strides in building public understanding that hazards in homes can poison, sicken, and kill us, that testing mitigation techniques are reliable. Today's NRAP Leadership Committee prioritizes making more funds available. The leaders of NRAP recognize that people who take control over their built environment and can afford to test or reduce high radon levels can be encouraged to address that risk through education and incentives, like tax deductions. For them, the NRAP aims to spur radon action by making testing and fixing obvious and easy. But for others, educational messages alone are not sufficient to drive life-saving action. Far too many people do not have the authority to test and repair their rental housing, their workplaces or schools that they occupy. And even those who do, the cost burden of repairs can be too great. For NRAP, one of our primary goals is to increase access to a government-backed and other sources of housing financing, identifying new funding sources, and help for states and tribes and local governments to fund radon controls in all buildings, especially in low-income communities and communities of color, and directing cancer prevention resources toward radon risk reduction. Today, we want to share some activity that we've been involved with through NRAP to make funding available for radon testing and mitigation, particularly for low-income occupants. We want to highlight and promote avenues that you can pursue in your states and in your communities to bring radon funding to your local housing. And with that, I'm going to turn it over to Amanda to talk about funding opportunities.
Thanks, Jonathan. As Jonathan has just been describing, and I think as many of you joining us today are likely aware and have experienced firsthand, often once a community is aware that radon is an issue, the biggest obstacle to taking action is funding. And that's not unique to radon, right? We see that across the spectrum of healthy housing work. In general, when we're talking to communities, they are seeking funding and support for programs, policies, and services that help raise awareness about the issue, with decision makers and residents, that this is a problem worth solving and that there are cost-effective solutions available to us. Programs, policies, and services to help us find where the hazards, in this case, which homes have radon, where those hazards are, and to help us mitigate exposure to those hazards. And also importantly, to help us monitor, refine, and sustain the systems that we're putting into place. And there are a lot of different ways that communities are finding funding for this work in each of these buckets. We're going to do a really light touch on multiple options today, not a comprehensive list, but a range of options with a deep focus, as Jonathan mentioned, on funding from HUD's Community Development Block Program. It's worth noting upfront that not all of these options may be available for your community, but as you listen today, we encourage you to start thinking about what you do have in place, or what you maybe don't even know whether you have in place or not, where you may be able to connect or partner with others in your community or some of the national organizations that are on the call today to learn more about understanding your local landscape and how to take next steps. For the most part, we're going to be focusing on funding opportunities that cover testing and home repair with a housing quality or indoor air quality lens or a public health lens. Some of these funding sources may not have a specific, single focus on radon. And so we're not going to be covering some of the programs that some of you may be more familiar with, including the state indoor radon grants from EPA. Hopefully we'll highlight some new ideas and opportunities for you. It's worth noting we're also eager to hear from all of you about other ways that you are funding this work at the state and local level, and encourage you to share during today's webinar or follow up with us afterwards, so we can continue highlighting a range of funding opportunities. I'm sure, as you are aware, that having that range of options, that menu of options, really helps other communities to not only identify what might work for them, but also really just understand and reinforce that message that this work is possible, which is probably the most important takeaway of all here. So we're going to dive in and take a few examples. But again, I'll just reiterate that the point is not for us to provide a comprehensive list or for you to leave today feeling like you're an expert in every single one of these funding vehicles, but hopefully just to provide some basic understanding of what might be possible and some ideas for resources about next steps that you might take in pursuing one or more of these options. So if we move to the next slide, the first opportunity that we'd like to highlight is the grant programs that are housed within the U.S. Department of Housing and Urban Development's Office of Lead Hazard Control and Healthy Homes. This office runs several grant programs. You only see a few of them listed here on your screen. These include the Healthy Homes Supplemental Funding that is awarded alongside some of the lead hazard control grants, the Healthy Homes Production Grants, and the Tribal Healthy Homes Production Grants that allow communities to address a wider range of housing hazards and conditions, the Healthy Homes Technical Studies Grant Program that provides support and funding to be able to conduct studies and answer questions about hazards that may exist in your community, solutions, testing different solutions and practices that may be available to address and reduce exposure to those hazards, and the Radon Testing and Mitigation for Public Housing Grant Program. As you see on the screen, most of these programs are offered on a roughly annual cycle. The eligible entities who can apply for these awards depend upon the type of award that it is. So for instance, the lead hazard control grants where we have the option of the Healthy Home Supplemental Funding to address additional housing hazards is available to local governments. The Healthy Home Production Grants and the Tribal Healthy Homes Production Grants, in addition to local governments and tribal entities, nonprofit organizations are also eligible to apply. The Radon Testing and Mitigation for Public Housing Program is limited to public housing agencies. And that Technical Studies Grant Program, you see there it says a wide variety of entities. On other versions of this slide, sometimes it says things like researchers, but I think it's important to note you may not think of yourself as a researcher, but you may have a really important question that your community and that the field needs answered about radon and radon mitigation. And a wide variety of entities, community-based organizations, academic institutions, governmental agencies are eligible to apply for and partner on these awards. I think the opportunity here is, first to identify if your community already has one of these grants. And if they do, consider reaching out to explore partnership opportunities during the current or a future grant cycle. And if your community doesn't have a grant, it's a great opportunity to start identifying community partners who may want to apply or support your application, depending upon which funding stream you're looking at. And HUD's timing is perfect with this webinar, as they have just announced that 2 of these programs are newly opened with currently open funding opportunities. These are the Lead Hazard Reduction Grant Program, which again can include that Healthy Home Supplemental Funding as an option to address a wider range of hazards in homes where they are doing lead work, and the Technical Studies Program. Both are currently open with deadlines in August. You see some links on your screen. You'll be getting a copy of these slides after the webinar today, and we encourage you to look into it. Also to reach out if you have questions about these funding streams. Next slide, please. Another important funding stream potentially is the American Rescue Plan Act. This is funding that was made available by Congress in response to the COVID-19 pandemic. We're hearing from many communities that, there was a rush to obligate these funds and have plans for these funds when they were first made available. But sometimes those plans haven't gone exactly as pictured. And in some cases, communities are right now looking for other opportunities to support eligible activities. These funds must be obligated by the end of this calendar year in 2024, and the funds have to be spent by 2026. We also know our team has been reviewing the reports that these communities submit to the Treasury Department about how these funds are being budgeted across the country. And we have uncovered a wealth of examples. In fact, I think last summer we had uncovered that about $1.7 billion had been budgeted so far for healthy homes related work. We've also talked to a lot of these communities, and they can provide inspiration and models of how to leverage these funds to establish or expand home repair programs, to increase code inspections and enforcement capacity, or bolster tenants' rights and protections, and more. A lot of examples there, and potentially an opportunity for some of your communities. Next slide, please. The Inflation Reduction Act is another bill that has produced several funding streams potentially relevant for improving radon and indoor air quality. For instance, as just a few examples, $1 billion was allocated to HUD to fund upgrades in HUD-assisted multifamily housing through the Green and Resilient Retrofit Program. And per recent HUD guidance on environmental review, which you'll hear more about later, both radon testing and remediation are eligible expenses under that grant program. Another important funding stream is through the Inflation Reduction Act is that EPA also received $3 billion for environmental and climate justice work. And these funds are being deployed in a number of ways that are potentially relevant for your local efforts on radon. If we move to the next slide, the first of these that we'd like to highlight is the community change grants. These grants are open right now. This is a right now opportunity. And these grants are designed to support community-based organizations and their partnerships with each other, with governmental, tribal, or academic entities to address environmental justice needs in a community defined by that community. So that could include improving indoor air quality and public health, which fall under the goals of this program. It also may be an opportunity to partner with programs that address indoor air quality or housing quality more holistically, but ensure that radon is being addressed as part of these programs. There are 2 tracks available for 3-year grants of up to $20 million in the highest track. It's also worth noting that there are rolling applications. This is a grant opportunity open now. You can submit an application at any point between now and November 21st, but EPA is also awarding these funds on a first come, first served basis. So there's a real urgency to submit applications as soon as possible. And technical assistance is available to assist with putting together these applications. A really wonderful aspect of this is that even if your application is turned down by EPA, you can get feedback. And if there's still time before the opportunity closes, you can have another chance at submitting again. Huge opportunity to get up to $20 million to address environmental justice issues in your community. The Environmental Justice Thriving Communities program also has a network of regional and national technical assistance providers to help with funding applications and other organizational needs, not just EPA funding opportunities. They can help you pursue funding opportunities with other federal agencies. And the link on your screen here at the bottom can help you identify your regional TA provider. These are called TICTACs. You see that acronym TCTACS. They're called TICTACs. Those are the technical assistance centers here. It's also worth noting that EPA recently announced the companion network of regional and national grant makers that will be providing smaller grants ranging from about $175,000 to $300,000 over a couple of years to address local environmental justice needs. There's no official word yet on exactly when those grants are open, but we're anticipating that those opportunities could open this fall or by the end of the calendar year. So certainly something to keep your eye on. If we move to the next slide. It's also worth noting that historically, EPA's Environmental Justice Small Grants Program has played a role in supporting indoor air quality work at the local level with grants that were awarded annually through 2022. In 2023, EPA issued 2 similar but larger groups of awards to community-based organizations and governments, which included at least 2 awards that we've noticed in North Dakota and in Utah that funded radon work. As EPA is working through the influx of funding through the IRA and is making awards through those other mechanisms I just talked about, it's unclear whether these smaller grant awards are going to return as an annual program. If they do, they could certainly be a source of funding to address indoor air quality and radon. And regardless, it may be worth identifying if anyone in your state or community has received the funds that are listed on the screen here and explore whether partnership opportunities are still available. Next slide, please. Earmarks that are known by the more polite terms of congressionally directed spending on the Senate side or community project funding on the House side are another potential opportunity to secure funding for a specific local project. This is an opportunity that typically comes up once a year and requires you to work with and through your representative or senators in Congress. The link on your screen is for a webinar that provides an overview of this opportunity and the process to use to pursue earmarks for healthy housing work, including noting, really specific tips like when you're asked about, you want to submit your fund through a specific funding account, that some groups have been able to use the Community Development Fund for home repair. So it has lots of really practical advice like that to help you navigate through the process. Next slide, please. And again, this is a busy slide that is meant to be a resource after today's webinar. We've been focusing a lot as the focus of this webinar is on federal funding, but I also just want to mention that another way in the door to federal funding, but also to potentially identify unique state, local, and regional resources is to reach out to housing partners who have traditionally conducted or financed this type of work at the local level. You can see on your screen examples of the type of entities that we're talking about, and also links to where you might be able to find them at the local level. But it's really, an opportunity potentially to identify another door into this funding. Next slide, please. The opportunity we really want to highlight today is funding from the HUD's Community Development Block Grant Program. There's a direct path in our minds from this CDBG, Community Development Block Grant money. They're improving home environments to having an impact on health. But we know from talking to many of you around the country that sometimes it's hard to trace it from this theoretical idea to an intentional practice. And we're really hoping that the rest of today's webinar and the resources and examples that we're about to highlight will help start to make the theoretical seem more possible and worthwhile. And with that, I'm going to hand it back over to Jonathan.
Thank you, Amanda. So I'm really excited. For many years, I've been frustrated because in working with NRAP and with others, there's been resources out there to give out free test kits and to provide for radon and for other sources. And we're testing, but we weren't giving people the resources to take action. And we've heard that CDBG, the Community Development Block Grant, was a resource, but it was often hard to find examples. So our brief, which we're excited to be able to be sharing through, you can go to our website, nchh.org, and find it. We have an opportunity now to lay out opportunities, and also in this webinar to share 3 examples from important partners. So we created this brief, this technical assistance brief, to support local and state leaders, governments, agencies, as well as advocates who need to understand how the CDBG funding works and can be used to accomplish housing repairs designed to create healthier, safer indoor environments. We use indoor air quality as the example that goes through this brief, and radon is one of those indoor air hazards that needs to be addressed. It can be addressed, is found throughout this brief, but there's background and strategies that can be applied through a range of healthy homes and other hazards in your community. So broadly speaking, our brief provides a high-level overview of the CDBG program. It details how funding is allocated, talks about opportunities to address IAQ and improve housing quality, the environmental review process, as well as the benefits of addressing and improving indoor air quality. It concludes with some considerations to keep in mind, some tips on how to get started, and shares some useful tools that can help if and when you explore this opportunity in your community. The CDBG program has about $3 billion in federal funding, $3 to $4 billion. It had a high water mark of about 5 million at one point. So unfortunately, it's a little bit down, but hopefully we can continue to advocate for additional funding to reach our needs. It was developed in the 1990s after people were in the 1980s after people were complaining that often HUD funding was too restrictive, too detailed, and it wasn't flexible enough for our communities. So now it allocates it on a formula. So there's entitlement cities that get the funding, and additional funding goes to states for non-entitlement communities. So as an example, in Maryland, there are 14 entitlement jurisdictions, and they get their direct funding, and then the state of Maryland gets additional funding that they can allocate to the non-entitlement areas of the state. It provides funds for states and localities for the creation and preservation of affordable and decent housing, support and improve public facilities, and economic development and job growth. So it has a lot of things it's trying to accomplish. Home repairs is just one small part of it, but the way it works is that communities have an opportunity to weigh in and let their priorities be known. So how is the funding allocated? Every community that receives funding is required to submit to HUD a strategic plan and HUD's consolidated planning process. And this goes in every 3 to 5 years. The consolidated plan or CON plan, which also covers communities' plans for other HUD community planning and development programs such as home and emergency shelter grants, outlines the community's needs and priorities on how the jurisdiction plans to use it for allocating this funding. And so it's supposed to be talking to its citizens, its residents, to understand where the needs are, getting that feedback, and then prioritizing it and creating the programs that'll best serve their community. And it also needs to do analysis of housing and economic market conditions, as well as other resources to bring to the table. So it can come back to HUD and say, we have a good plan. We know what our community wants, and this is how we're going to use the government money wisely. So within that, many communities look at home repairs as something that is a priority for their community. And then within home repairs, IAQ, or indoor air quality, is a qualifying event, something that can be treated with CDBG funding. So some of the things that we've heard people have addressed are deferred maintenance, which can cause many problems that create hazards in the home, installation of security devices like smoke detectors or CO alarms, abatement of contaminants, broad categories under a range of conditions to improve IAQ, which may include reducing elevated radon levels. And there are 2 pathways for using the CDBG funding. One is to include the IAQ in the strategic plan, in the multi-year consolidated plan, or to add IAQ as an amendment to your annual action plan, which is another element of what's required to go back to HUD and let them know what you're doing with your CDBG funding. So this is a quick overview. It's only 10 pages, but the brief provides many examples of home repair programs that have added radon testing and mitigation to their eligible activities. We can get into this in more depth with our partners who will be presenting shortly. And we look forward to giving you some tips and tools to do it in your own community. But before we get to that, just one other item that's sort of recent news. Programs using CDBG funds, like other HUD-funded programs, must conduct an environmental review of assisted properties before spending the funds, depending on the defined what's going on with that program. Some are exempt, but for the most part, environmental review is a requirement. HUD recently clarified in a program notice that radon must be considered during an environmental review. And the effective date of that new policy was April 11th of this year for non-tribal recipients, and January 11th of 2026 for tribal recipients. So the link can be found here on the slide, which we'll be sending out the slides, and you'll be able to access this. And you can learn more about the environmental notice, review notice, and what it means for programs to fund radon testing and mitigation. So to wrap up, this was just a quick overview. We hope that you will, be inspired to get this document, to use it, to think about how you can use it well in your community. So the tool outlines points to consider as you explore incorporating IAQ into your CDBG home repair plans. It helps you think about how to get started, because often that first step is the hardest. And recognize that if you're not the person in your community that's responsible for it, you need to reach out to those who are responsible. And as I said, everybody has to have a comp plan and an annual plan. So there are opportunities that your community must be making available to you as advocates to move this forward. The document itself also adds additional resources for more information to support your work. So we believe these are some of the most useful sections of the brief in terms of taking that theoretical idea of, yeah, there's a source of funding out there that can be helpful, to this is how you can do it, this is how you can move forward, this is how you can change things in your community. So quick overview, but I think that the best way to hear about it is to actually hear from people who are really doing it. And so I'm pleased to introduce our next three speakers. I'm going to do them all at once so that I don't have to break it up. Our first speaker is Christmas Hudgens. She is as you can see on the screen, the state CDBG programs director in Indiana for the Office of Community and Rural Affairs. She'll be followed by Amanda Best, the policy and program manager for housing stability of the Housing Stability Division in Salt Lake City. And then finally, we'll have Julie McKeel. She's the community development coordinator for the city of Leavenworth, Kansas. So with that, I'll turn it over to Christmas. Thank you so much.
Thank you very much, Jonathan. Well, it is very good to be with you all. Today, as was mentioned earlier, my name is Christmas Hudgens, and I represent the Office of Community and Rural Affairs. I will affectionately refer to us throughout my presentation as OCRA. But we oversee the state's non-entitlement funds. So each year, the state receives an annual allocation of about $31 to $32 million to assist with eligible needs across the state of Indiana in our rural non-entitlement communities. As Jonathan talked about a little bit earlier, HUD's recent policy notice established radon testing and mitigation requirements for the CDBG program. And so since that time, we have had a team of individuals here at OCRA working on how to operationalize those requirements, which for us means looking at ways that we can build them in to our existing program architecture, our existing environmental review process. For us, it's very important that we develop agile processes that allow for changes and new flexibilities and new requirements to be built in easily, because we want these things to be realistically accessible and doable for communities. So these new radon requirements apply across the board. We fund a lot of different types of projects here in Indiana with our state CDBG dollars, the majority of which are capital improvements projects, large-scale capital improvements projects, either new construction or rehab of historic properties, downtown streetscapes, facade improvement programs, wastewater, drinking water infrastructure, stormwater infrastructure, blight clearance. And for those types of projects, we've developed specific policies and procedures to ensure that we are in compliance, that our grantees are in compliance with all of the radon testing and mitigation requirements outlined in the notice. But where this is really going to hit home for us locally, we do allocate about $3 million a year of our annual allocation to fund owner-occupied repair programs here in Indiana. Now, those programs are awarded to communities who then create local programs by which they will award and distribute the funds locally to homeowners. And so we needed to make sure that those requirements were clear, and that the community and their local grant administrator understood exactly how and when to engage homeowners how and when they could ensure that those costs, both for testing and mitigation, were reasonable. And I mean, obviously, the notice outlined that those expenses could fall under allowable administrative costs for the grant as part of the environmental review fee that our grant administrators charge to communities. The mitigation costs can be included as part of the overall construction expenses for projects funded by community development block grants. And so as far as costs are concerned, that was kind of the easiest part for us because we wanted to make sure that was made clear so that those costs weren't passed on to homeowners. They are in fact covered by the award. Locally, communities can award up to $25,000 per home. They could award less depending on what the goals and objectives of their local program are, but we did put a cap of 25,000 per unit on each of those. That testing, when and where they do that, kind of depends on the type of project. For new construction, for example, they're exempt from performing initial radon testing. However, they are still required to develop a mitigation plan and to incorporate radon mitigation devices into their project design and budget for construction. And then they will have to do post-construction radon testing to verify the installed radon mitigation equipment is functional and that radon levels are below the allowable limit as defined by the policy notice. For non-residential buildings, that testing does have to be done by a licensed radon professional. For residential buildings, it can be performed by the homeowner and the occupant of the dwelling. And so for us, a best practice recommendation that we identified early on was outreach, making sure that communities were engaging with potential homeowners who would be applying for funds early and making them aware of the impacts of radon and therefore the subsequent need to do testing and mitigation as part of their project plan. We also talked about making sure that if local communities wanted to offer do-it-yourself testing, at-home radon testing by an occupying homeowner, that was something they offered to them as a no-cost option, and that their participation in the program wasn't contingent upon their willingness or ability to self-perform a passive test at home. A lot of the homeowners, a lot of the targeted populations that we encourage communities to prioritize this funding for may have accessibility challenges. They may be elderly, they may be disabled, and if they're not comfortable doing that at-home test, we don't want them to be put in a position where they felt like they had to. Radon mitigation in non-residential and residential buildings obviously has to be performed by a licensed radon professional, but communities have some flexibility in the policy that we've developed to either offer as a no-cost option do-it-yourself tests, or they can offer that testing as part of their administration costs that they submit with the grant. And then they will do that as part of our established environmental review process. Because with OOR, they don't necessarily know the project sites at application. They'll do what we call a tiered review. And so they will submit those project sites post-award so that our environmental review officer can review everything and ensure that all of the testing and mitigation requirements have been met in order to release that environmental review record. And then after implementation, they'll do some post-construction testing, post-rehab testing to ensure that the radon mitigation equipment is functional and effective in reducing those levels before they can move forward to close out. So as far as process, all of that, of course, we've now built into our existing process. We've updated our application instructions, and we're going to be doing some trainings with local grant administrators to ensure they understand their role and responsibility in supporting the community in meeting these requirements as effectively as possible. And then we'll, of course, provide strategic support and technical assistance along the way. But I would certainly say that for any of you with questions about how to implement that at the local level, your best option would be to engage with our community liaisons. We have a team of field outreach personnel, folks who represent Okra, but that live and work in the communities that they are a part of. And they meet with those local leaders to provide that kind of upfront boots on the ground technical assistance, insight on what different options and opportunities exist to do this kind of work in Indiana. We'd be happy to share a map of those community liaison districts and their contact information with your participants. If you move us ahead to the next slide, I've also included some links to some of OKRA's currently available resources. There's a link there to our programs and policies page. We will have our proposed radon testing and mitigation policy available for public comment here on our website this week. So we're looking forward to hearing back from all of our key project stakeholders on how, if or how that can be improved before we formally adopt that policy. And then, of course, we've already started building some of these requirements into our existing programs. And you can see here links to our owner-occupied rehabilitation program, our recovery housing program. This is probably the one other place where OKRA kind of dips its toe into the waters of residential programming. This is a pilot program that the state received funding through the Support Act all the way back in 2019 to support the creation of additional transitional beds for folks recovering from substance abuse issues here in Indiana. And so we do not currently have an open round for that program, but we will coming up here in the next year or so, as we received an additional allocation in 2024 of about $1.1 million. But with that, because I know our time is short, I think I am handing off to our next presenter.
Thank you. Next up is Amanda Best. Thank you.
Thanks, Christmas. Hi, I'm Amanda Best, the Policy and Programs Manager for Salt Lake City's Housing Stability Division. I'm over the homeowner programs, and one of which is the home repair program. Salt Lake City has been operating a home repair program for the last 30 years in a variety of ways with a variety of funding. Currently, it's funded through CDBG. The home repair program does large necessary repairs for health, safety, and structural issues in residential homes. Typically, the homes are over 50 years old, and to be eligible, all homeowners must live in Salt Lake City boundaries, use the home as their primary residence, and be under 80% AMI. Our program maximum is $50,000, and we typically serve between 10 to 15 households a year. Before we create the scope and do the bidding process, we complete radon testing and lead-based paint risk assessments. These tests inform the homeowner and us what additional items may be needed in the project scope. So we have 3 radon test machines that we own and that we use, and the software that gives us the reading and the limits. The rehab specialists who work for Salt Lake City are the people who go out and complete those tests. We give the homeowner the results, and they have the option to do mitigation at any level. And if the homeowner wants to do mitigation, it's included in the home repair loan that we use CDBG funds for. Most homeowners do prioritize other work on their homes that seem to be more urgent or structurally necessary. In the last 5 years, we've done 2 radon mitigations. The cost is typically between $2,000 and $4,000. But they always have that test, the radon test, for their records. We've been doing radon testing for at least the last 5 years, and it's a consistent part of our program at this point. And the homeowners don't pay for that at all. It's coming out of our admin. And according to the Utah Department of Environmental Quality, the DEQ, Salt Lake County has very high levels of radon. A lot of the homes we work with in Salt Lake City were built in the early 1900s and have dugout basements or crawl spaces. Not a lot of people frequent their crawl spaces or dirt basements, but it's typically where the furnace is located. And so if the homeowner goes into that area, it can increase the likelihood of more direct radon contact. Utah DEQ has a program where individuals can purchase low-cost kits and ways to reduce levels at home. And they also have a list of certified radon mitigation companies, and we use that list if we do mitigation. My division, Housing Stability, is also working closely with Sustainability Division in Salt Lake City, and they're creating indoor air quality programs as well, using our general city funding for things like furnace filter replacements and indoor air purifiers. And then the EPA grant was mentioned earlier. There are a couple nonprofit organizations that are in process with that grant to have a radon mitigation focus as well. So that application is still in process, but it is another resource that we plan to provide homeowners if they choose to use our home repair funds for other repairs. And then that way they can have other options for radon mitigation in their home. Thanks. I'll pass it over to Julie.
Amanda and Christmas. That was really nice to hear others who are administering these programs. It's very insightful. Well, I'm here. My name is Julie McKeel, and I am the Community Development Coordinator for the City of Leavenworth, and I administer the city's CDBG entitlement funds. My grant year ends here in about 5 days. So the 2023 program year, the city received $340,000, in which $90,000 was allocated towards a CDBG funded minor home repair program for owner occupied homes. With a lot of the same requirements in Salt Lake as Amanda had described. So qualified applicants can be awarded up to $13,000 worth of repairs or replacement. And as we all know, environmental reviews are required, hence then the radon. So we didn't have any radon program put into place, and so one needed to be implemented. And like I said, we're about 5 days away from wrapping up this first solid year. So here's a little synopsis of what I went through being a much smaller entity and being in only a one person that administers all of these funds. So I went at it with an approach of educate, consult, proceed, and then what are results? There's always going to be room for some fine tuning and further education, but here was my experience. So the first thing I did was make sure that I educated myself very well on what exactly radon was, so that I would be able to communicate with citizens or any other entities that I spoke to, or anybody that I was going to reach out to when I needed to consult or collaborate with, which HUD has a lot of really great information. So does the Kansas Department of Health here. And so it was very easy to find a lot of really good education and resources that have also been shared with our citizens here. So the next thing I wanted to do for educating myself to administer this was evaluating what my local community knew and did not know in regards to what radon was, why it was so dangerous, and all of the details about mitigating and how do you test. So I simply started doing Google searches, right? And I started asking questions with local health department, local hospitals, clinics, our website, surrounding cities' websites, wanting to know what information really is out there so I would know how to go about this. I also made sure that this program year, we put on the actual applications for the home repair program, what exactly radon was and why we test for it. And of course, further information is given. I also found out that the state of Kansas has a Kansas radon certification law when I was doing this research, and also from another entity that had helped me out with some information. This law requires that hired mitigation services have to be certified by Kansas Department of Health and Environment, and known as KDHE, and they also provide a list of those contractors, which made procurement much easier and to feel better about that we were using the correct resources for this. If the radon testing is going to be performed by a hired contractor, then they should be amongst that list of those that are certified. So as far as the consultation that I had with others, a lot of lenders are requiring for radon testing to be performed, particularly in this area. I don't know about others. Leavenworth City sits inside Leavenworth County, and it is a zone 1 zone, so known to have higher levels of radon. So some of the lenders are requiring this to be done, and a lot of the local realtors are very familiar with radon and its testing too. So I definitely was communicating and consulting with them about their experiences just to get some education here locally on a local level. So once I had completed an evaluation and potential mitigation costs by benchmarking mitigation costs in the surrounding area, I came to the conclusion that needed to go to a community development advisory board and ask for them to approve for an additional $1,000 grant to be given to any qualified applicant for radon mitigation needs if they would need it. Because of course, if their readings for picocuries are higher, it would require to be mitigated. So the Kansas State Research and Extension Office here in our city has been quite the blessing. They have charcoal tests for $6, and this also includes the lab results. So we keep costs down here so that we can keep spending the CDBG funds on our citizens for this home repair program quite easily, and it's very nice. So the $6 is not very much at all. And so we go in, I go in and put in these charcoal tests in the homes, following manufacturer's instructions to a T, and send it off after the 2 to 3 day period. And I end up getting an email that gives me the results to that testing. If mitigation is needed, then we definitely go back and retest, of course, to make sure that that the mitigation went well. I also do the testing myself, as Ms. Hudgens have pointed out. Sometimes applicants are elderly or disabled, or maybe struggle to get to the lowest point of their home, such as basements. And it just makes it much easier, because then we can also know and confirm that the test was performed correctly as well. So far to date, I have had 13 homes that have been tested here in the city of Leavenworth. 2 of them did require mitigation, and of course we retested and got excellent readings. One of those homes was a mobile home in a trailer park that was tested. It did not have a higher reading, but for the sake of conversation, it did have a 1.6 picocuries reading, in which that definitely debunks the theory where some people believe that there is no radon possible being able to capture in those. So I thought I would share that. I definitely keep a spreadsheet of all of my results. My spreadsheet contains the serial numbers and the brand of testing, the addresses, the start date and time of those tests, and what year the house was built. Specific details to the location of the test, like was it 5 feet off the ground, approximately 3 feet away from a wall, these kinds of things. Also, any comments or anything that may seem pertinent to that test, indicating if the mitigation was needed, and the retesting information. So while it was a little bit scary to be able to be jump on the board of being compliant of the unknown, I say break that fear and dive in. And thank you for letting me share my experience.
Hello, this is Kevin Stewart, and I'm with the American Lung Association as Environmental Director. I understand we are very short on time, and I did want to reflect for all of the folks attending that we do intend to take all of the dozens of questions that have been asked both before this call and questions during it. In fact, people could still enter the last thoughts in their minds right now. We do intend to review those and then provide something as a summary kind of overview in terms of making sure we're addressing those questions. I know one thing that was a theme of questions that were brought earlier was the scope of what was needed for what could be funded, what was available. And I know there's so many different levels of this, state and local and at the individual level. But do you handle the issue about the there's low to mid-income homes, owners and tenants, tribes, single-family homes, multi-unit, commercial, schools, and I think there's a lot of question about, well, where do I go specifically? And maybe the NCHH has in its guidance document some good directions to help people navigate this whole row of different toothpastes. How do I pick the one that's appropriate for me? And I'll turn it over, to Amanda Reddy or Jonathan Wilson, I think, to bring us up to a close here.
Thank you, Kevin. Yeah, you're right that it is a complicated web sometimes, but there is, when we're talking about CDBG, there is just one office within your community. And so, finding that office and talking to them about what needs, what they can offer. There's different flavors of home repair programs. You can actually even have CDBG doing rehab programs, which is different from home repair. So it can get complicated. Our brief does try to give you a roadmap and help you. So again, encourage people to go to nchh.org and get that. But I realize that we are at time, and I do want to thank everybody. We had a great attendance today, some really good questions, and appreciated all the interest in the topic. And I hope that we've been able to inspire you to seek out more information and actually take action within your community, because we will be better off if everybody does their little part and takes action within their community. I don't know, Kevin or Tiffany, do you want to speak about the evaluation?
I think back to Tiffany then, yeah.
Sure. Thank you, everybody, for attending today. We do appreciate you sticking by just these last couple minutes. Here you can see on the screen is a QR code for the evaluation link. We'll also send this around in an email to all registered attendees, which will also have the PowerPoint slides so you can see all the great resources that were linked, as well as a webinar recording, the presenter bios, and any other resources that we'd like to mention to you all. So I think if they just go to the last slide here, and again, thank you so much to all the presenters. Thanks to the National Center for Healthy Housing. And we appreciate everybody being here today. And we'll be in touch as well with the commonly asked questions. Thanks so much. Have a great day.